I would say my biggest advice for anyone getting into this realm is don't let great be the enemy of good. Just do it. Because I speak to a lot of people they want to do this, they're interested, but everything has to be this perfect, beautiful bundle. And that is not real life. And the reality of life is you could construct the most perfect, beautiful bundle, but something is going to shift.
Hi, guys, and welcome to the House Call Vet Cafe podcast. I'm Dr. Eve Harrison. I'm a full-time integrative concierge house call veterinarian in Los Angeles, and I help other vets to build their unique mobile practices on their terms. This podcast is for and by house call and mobile veterinarians, so it is meant to give our community a platform to connect, to share our stories, to lift each other up, and to support each other. Most of us work solo as lone wolves, right? So for me, it's been really powerful to be able to physically hear the voices of my colleagues from all over the world and to get a chance to feel that we truly are part of a community of very real other human beings who get it. While you may be alone in that little bubble of your own vehicle when you're on the road seeing patients, I welcome you to join our community by tuning into our own podcast when you're on your way to your next house call. Whether you're a super experienced house call vet with 30 years of experience, you're a brand new prospective house call vet just looking to get started, or you're house call curious, there will be something for you in this podcast. Each episode, you will hear interviews from other mobile veterinarians just like yourself who are doing unique and innovative things, vets who are sharing their stories, their struggles and challenges, and you can also look forward to hearing valuable information and perspectives from specialists and experts outside of our micro niche. And finally, if becoming a house call veterinarian is something that you've been thinking about exploring, or you're looking for some extra support getting your own mobile practice to feel more profitable and sustainable for you, check out the information in the show notes about my course and our above and beyond supportive private community for members only, plus our monthly group coaching sessions within the House Call Vet Academy. You can also check out my free public Facebook group, which is also called the House Call Vet Cafe, the same name as this podcast, and which is a warm and cozy community for mobile vets to support each other in professional and personal development, in creative entrepreneurship, and in friendship. So thank you guys for spending time with me today. Let's dive into the episode.
Hey everyone, today we have an awesome guest with us. We have Dr. Lisa Kril. She has a micro mobile practice in Guelph, Ontario, where she provides house calls for acupuncture, euthanasia, and comfort care. Her primary focuses are pain relief and comfort while providing a cozy, supportive experience for pet owners and pets alike. She also works as an emergency vet and in a referral rehabilitation practice. Her mobile practice has allowed her to feel so many sparks of joy and connection and complete a workday without her shoulders being around her ears. I absolutely love how you say that. I love having you in the House Call Vet Academy as well.
Hmm.
And it's been beautiful to watch your practice. I stalk you relentlessly. So just to put that out there. Um, you're wonderful. I'm so happy to have you on the show. So I'd like to start out the question with my usual question. Are there any snacks that you like to eat in the car on your way to house calls in your micro mobile practice?
Yeah, so I am a smoothie girl. I love bringing a smoothie with me. It lets me actually have something with nutrition, but that's also delicious because I'm not going to lie, I would love to eat more vegetables in my life, but it's not going to happen. It's the fruits.
It's not gonna happen.
Yeah. It's usually like something with raspberries and almond butter, so it's like a little combo.
Ooh, I love almond butter, and
Mm.
I'm right there with you. I was gonna ask, like, what you put in there, and you answered it already, so that's delightful. Do you have a smoothie, like, every day, or is it just, like, when you can?
I kind of go through phases. I would say I'll have smoothies like solid, 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 and then I'll just go through a phase where I'm like, I think I need a carb.
And what is your choice of carbs?
Oh, I make muffins and scones sometimes, and I love that. I anything baked, I want it.
Okay, so you're like a baking goddess. Got it, okay. There's some people who are, like, some people are really into cooking, some people who are into baking. It's like a real dichotomy of humans. So
I'm the baker. That's the split in our household. I'm in charge of all of the baking and I don't touch the cooking, and he is very much allowed not to do any baking.
that's awesome. My husband is the cooker, the dish doer, and all the things of the kitchen. I just, like, make myself beverages. Very lucky that way. But anyway, it's good to know what we're dealing with here. It's great. So, food things aside, can you tell me a little bit about how you got started with your house call practice and what that journey has been like?
Yeah, absolutely. So I always knew I wanted to do something with pain relief, but I didn't really have house call on my mind. And still, I started to practice a little bit, work a little bit. So initially, I started doing fully ER, which in some ways I loved. And in other ways, I was like, oh my gosh, this is awful.
Yeah.
Especially just being an empathetic person, not being able to support people all the way through their journey and just contorting yourself into knots to make the whole thing work. So after doing that for a couple of years, I knew I couldn't do it long term, and I started to think, how do I do something sustainable that I'll enjoy? And house call kind of called to me just because of the low overhead. It seemed achievable, it seemed sustainable, and it seemed light and able to sort of move quickly as I sort of added on, figured out things, changed things. But I'm a little bit of a cautious person. So I took a GP job working in feline medicine where I said, listen, I want to do this, but I want to do house calls out of here. I want to do in home euthanasias. I want to do palliative care. And they were very cool about that. They said, go for it, essentially, which was great. But there were no protocols. There was nobody doing anything for years there. So I sort of got to go back to the drawing board in a really low stress way, in a sense, being that it was somebody else's dime, somebody else's equipment, and figure out, like, even what do I bring for an in home euthanasia? What do I bring for a palliative care house call? And I kind of wanted to see if I liked it, and I just immediately loved it. I loved being so close to people. The animals are totally different in the house call environment, as you know.
Yeah.
I love seeing just people's personalities, the way they decorate their house. It's a totally different experience. So it just really clicked for me. Like, I remember one day saying to my tech, like, man, I could do this all day. I could. I just love it. And during that time, I was also working on my acupuncture certification. So I got acu certified. And then from there, I've just been slowly easing out of my emergency work. I'm doing a little bit of canine rehabilitation right now as well, which is great as I work on that certificate because one can never have enough certificates. um, and
Exactly.
just building the practice as we go.
That's beautiful. I love that. I think that's fairly unique, actually, that you were able to start doing house calls through another GP practice.
Mhm.
That's neat. That's really, really cool. And I love that you were able to get the flavor of it and know that you really enjoyed it. Are you still linked with that general practice? Or are you on your own at this point?
I'm on my own. I do house calls. They often refer to me, but I'm not affiliated with the practice anymore. So it's the house calls are all me, all Solace. Solace Vet Care is me. And I love that because everything can be my personal flavor and my personal decision. And then I can help support everyone in a way that really makes sense to me.
That's 100% what it's all about. I love
Mhm.
that too. I That's
Mhm.
my favorite thing about being house call. I love that you also talk about being like micro mini. Like that's to me,
Yeah.
that's the part of it. That's like this is like a tiny little unit and it's like not out of control. Like you mentioned, the overhead is minimal and it's all you, like you have a practice that's you and that's it. And it's
Mhm.
wonderful. And I love your practice. It's just awesome.
Yeah.
So you're interesting for a variety of reasons other than your start with the general practice, which is quite interesting in and of itself. But you've got an interesting kind of history of being an RVT prior to becoming a vet, and you're a newer grad as well. 2021. How has that transition been? How has it been? How does it feel to be a practice owner being a newer grad? I mean, you're not that new, but like a little
Yeah.
bit new. And
Yeah.
um, yeah, like what was that transition like? How's it been?
Ooh, I would say at times there's been a little bit of imposter syndrome in the sense that, like, am I really? doing this.
Yeah,
But
you
at
are.
this yeah. But at the same time, I have been doing this for years, you know? When I was an RVT, I loved being an RVT, but I always wanted to do more. I always wanted to offer different experiences to the client, more care to their pet, things that maybe were out of the box, you know? So I feel like I'm taking a lot of that and being able to infuse it in my practice. The newer grad thing for me, I think I'm lucky that I had good foundations and was relatively confident in medicine, but I'm also offering a limited scope of practice that I'm extremely confident in. Really focusing and narrowing down on, the pain management, the geriatrics in a palliative, supportive sense, and then the in-home euthanasia work sort of takes it from being this broad spectrum to almost laser focus, which would be an excellent point for me to make a pun about a laser, which we do have now.
If you weren't gonna do it, I was. Just
Yeah.
picking up what you're putting down.
But you can kind of just, like, target it down, and I think in some ways, like, yes, I'm a newer grad, I've always been more confident, and I've always just felt like the answer is only a book away, a phone call away. So for cases that I'm confused by, I don't know, like, I am very real that, "Hey, this is what I think is going on, but I wanna be 100% sure that we're doing the right thing. So I'm going to phone a friend, or I am going to circle back, do some research, and then we're going to talk about if anybody's used that in a cat before, and we'll go from there."
Oh, I love that. So I have so many strings I wanna pull on from what you just said.
Mhm.
I think that first of all, like being laser focused, I think is one of the really beautiful things about house call practice. You really can niche down, and we are specialists. There's not a specialty, but like you can get
Yeah.
certified as a house call vet through me, but but we're also we're specialists in my opinion. And I think that that's a much more comfortable place to be and a much more productive place to be. We're going to be better at the things we do every day over and over again. In human medicine, I mean, the GP doesn't do surgery. The GP doesn't do, I mean, they might do like psychiatry, but they often would refer out for psychiatry. They wouldn't do dermatology other than the most very basic things. They're going to refer out to a dermatology. Like our GPs, not that we necessarily need to refer out, but the way our profession is that a GP or an ER doctor are really expected in our profession by our own, expectations on ourselves, by the profession, by our clients, and maybe down the line, the expectations will shift. But right now, the expectation is that we know a little bit of everything. And some of us are really good at everything. But the reality is, you're going to be better at the things you do. If you're doing the same niche things over and over again, you're going to be happier. You're going to be not flailing. We're not flailing, most of us, but like to some extent, the profession is, and I wonder to what extent it is that we are so spread thin in terms of the things we're expected to have mastery over. And on that note, I love that you phone a friend. I phone a friend too to this day. I'm quite experienced. I'm in the heart of my career. I feel like I'm like not new. I'm not ancient. I'm right in it. I feel really good about what I know. But I phone a friend all the time. I'll do it right in front of the client. I'll be like, I've never heard of that, especially when we're in holistics.
Mhm.
The holistic work, there's so many kind of cutting edge aspects of pain relief that are emerging on the scene and we may not know about it. Our clients may have read something on Instagram from someone
Yeah.
and we're like, "Well, shit, I really don't know." So you're valid for bringing that to me and I'm going to meet you there. So I love that you do that. I love that you bring this confidence. I imagine like being in the field for a long time as an RVT, you learned a lot. And I'm curious also, I have so many directions I want to go. I don't want to lose my thread. Actually, I want to ask you this question in just a minute, but um what you also said, it's just a book away. It's just a phone call. That's beautiful. I love that. It reminds me of a saying that my dad says that he learned from his dad, that I think maybe learned from his dad. That's like, if you have a mouth, you can never get lost. So this refers to
Mhm.
directions, but if you're able to ask someone for help and directions and you're willing and able to do that, you're never going to be lost as long as there are other humans around, right? So it really reminded me of that, and I thought that's a really beautiful and I think really helpful way for people who are listening who might struggle also with imposter syndrome. I think that's everyone.
Mhm.
I think the answer's there. You have community. You can phone a friend. Clients actually like that. All my clients love it. They're like, I could see their face light up and they're like, she's taking me seriously. There's something she doesn't know and I taught her. And I'm like,
Mhm.
yeah, that's great.
I love that phrase. I think that's so lovely because it's true. And I think there's a huge risk of having our egos take control in veterinary medicine where I need to know what's going on and I need to know instantly and I need to act with decision right now. And the reality is, the more that we collaborate, the more that we listen to our colleagues, the more that we put that aside and really listen and search, the better vets that we're going to be. And like you said, clients love it. They feel so heard. I have never had anyone react negatively. Yeah. So I think it's a beautiful thing to sort of keep in mind.
Yeah, absolutely. I think that having people be heard and seen is something that is sorely missing, I think, from the culture of our profession. I mean,
Yeah.
there are individuals who know this is what is necessary. Like, there's so many amazing house call vets and like end of life doctors and practitioners and things like that who know, like, you have a gut feeling they need to be seen and heard. And that is just as important as every other component of what I'm offering.
Mhm.
The profession doesn't teach it. You have to know that from within, but I think it is teachable at the same time. So I'm so glad we're talking about this because I feel very strongly that that is such an
Mhm.
important aspect of what we can provide as house call vets in many practices. We have the capacity, we have the intimate container, we have the one-to-one connection. We don't have the time pressure that
Yeah.
gets put on vets who are, even if you know the client needs to be seen, you don't have the time necessarily, right? Like you're an ER, like
Mhm.
I'm sure that's a mind fuck of its own. I know it is. I've done ER. It's crazy.
Yeah, it's a
Yeah,
totally different experience.
totally.
Whereas I feel like when I am in people's homes and I'm with their pets and I'm there for these long periods of time, I'm getting all this information from them that we didn't have before. And they're bringing up questions that I know they've been afraid to speak to another vet. Like, will my dog run again? And I'm like, oh my God, you've been to the specialist, you've been discharged. We're like months into maintenance care. Like, what an important question that's like been in your heart that you haven't been able to voice, and it has so much like vulnerability and fear and like, yeah, let's talk and let's work through it and let's figure things out. Or the number of people who I speak with and after a few sessions I start to get out that they've stopped sleeping because their dog doesn't sleep well and they're sleeping on the floor with their pets, and it's just this huge struggle for them, but they've accepted it as normal. And I'm like, "Oh my God, let me help you. Like, let's no, like, it's not good for you. It's not good for them." And I feel like we end up in this space where we're almost caring for everyone, um,
Yeah.
which is like this huge value to this house call experience. Like, I really can't say enough. Like, it's a little bit difficult to pin down. Like, I can't make a flyer that says, like, "I'm gonna take care of you," but genuinely, the support that I think people are getting is, like, a huge part of what we're offering.
I couldn't agree more. I mean, it's such an interesting subject because, like, you have people who are like, well, I'm not your therapist and I don't want to hear Fluffy's entire life story. And it's like, well, when you have the time and you yourself, as you said beautifully for your bio, your shoulders aren't up around your ears all the time. The natural state of human beings is to want to connect, is to want to be there for each other. We're doctors, like, we're veterinarians, we care. We're very caring, empathetic people. And I think when the suppression of that from the systems we work in is lifted, it is actually we do wanna hear their life story. We
Mhm.
do. That's what it's all about. We love animals. We love people. Why is my computer dinging and ringing? Whatever. But, I think it's very normal and natural for people to be like, "You're a lover of animals. I'm gonna tell you what's been going on." We are not scope of care, of course, like, we are not therapists. We are not, but we're humans, and humans
Yeah.
connect. There's some degree of empathy that I think the words wanting to come out of my mouth are that we almost owe it to our clients to be there for them as humans as well. Like, I think this like white coat compartmentalization is not actually
Yeah.
good for anyone. It's not good for us, even though sometimes we think maybe it is. We think we lump that into boundaries, but I think boundaries are a different thing, rather than just like allowing a natural human connection in a high intensity, high emotional circumstance to exist, to be in its natural state, right? I mean, there are boundaries around that where it's like, okay, I've been here for an hour, I really gotta go, or I've been here for 3 hours, I really gotta go. But I think that the heart of this, like allowing the connection to happen, allowing us to feel that we are not just robots, animal fixers. It's like, no, this is a holistic situation. Our clients are our clients. We are tasked with their well-being on a certain plane, right? Not fixing, but we are tasked with caring for them as well. And so I just love how you've framed this, and I love how you think about it. And I think that's really, really special and important. And I think that's the house call paradigm. It's like
Mhm.
we're not just these doctor robots every 15, 30 minutes. Next, next, next. It's a deeper connection. And I think that for human beings in this role to be happy, we need that connection, you know? That's how I feel anyway.
To be happy, I think, is kind of critical there because not only is it something that you feel good about in the sense that, okay, let's say you're in the clinic environment, the system is you have 30-minute appointments, tick, tick, tick. You really don't have time for connection. You don't have time to breathe. Whereas in this alternate house call space, not only do you get this wonderful connection, you feel good at the end of the day. Like, it's very bizarre how, like, I can look at my day and sometimes I'm like, "Man, I'm so tired. I do not wanna go. I do not wanna drive over here. I'm just so tired." And then I go and I come home and my partner's like, "How was your appointment?" And I was like, "Great. I had a good time. We talked about this and this and so feels better." And it's almost like healing and stress relieving in its own way. And yeah, you have to set your own boundaries. There's some people that would have me move in, and that is totally, totally fair. But sometimes I have to be on to the next. And if you're confident with that, I think it can just really be something that contributes to the pet, it contributes to the client. And then as the healer, it contributes to you because you're doing it in this way that is just so holistic and supportive of everyone.
Oh, so beautiful. I feel like I could have said the same thing. Like, there are times where I'm like, "Oh, I have to go out and see an house call," but it's more inertia than anything. It's like I was in the middle
Yeah.
of doing that, now I have to go do this, but, like, when I go, like, even the minute I get in the car and I turn on my music, I'm like, "Ah, my happy place," and then I get to my client and I'm like, "Yes, I would rather hang out with them than some of my actual quote unquote friends," or you know what I mean?
Yeah.
I've, like, hand selected my clients so well that I'm like, "Why wouldn't I wanna spend time with them?" They're, like, really good friends to me now, and I love caring for this animal and it gives back. It's such a two-way
Yeah.
street, and I love how you said that. I feel exactly the same. Oh, that's brilliant. Hey everyone, this is Dr. Eve Harrison here. For my fellow house call veterinarians who feel the daily weight of solo practice, and for those dreaming of mobile practice but unsure where to begin, this one's for you. I'm super excited to announce that registration is now open for our fifth annual House Call and Mobile Vet Virtual Conference, February 7th and 8th, 2026. So mark your calendars because whether you're struggling with pricing, boundaries, work life balance in your current mobile practice, or you're looking for a clear roadmap to start your house call journey, we've got you covered. This isn't just another CE event. It's certainly not another corporate CE event. This is the only event of its kind taught for house call vets by house call vets that covers exactly what is relevant to you. We're diving deep into the real challenges of mobile practice from managing red flag clients to firing clients who aren't a good match, to knowing what to do when business is slow, to marketing, to starting a house call practice, to all sorts of integrative and holistic gems, standard Western house call medicine pearls, to working through grief and challenges during IHE, to tackling imposter syndrome. We've got you covered in all of these ways. You'll leave with actionable strategies to increase your income, protect your time, and build a practice that truly works for you. Here's what two of our attendees had to say. Thank you, Eve, for an amazing conference.
I love how you spoke from your heart and how you and the speakers were so encouraging. I've been thinking for a while about going mobile solo, and you made me feel empowered, knowledgeable, and not alone in designing the work lifestyle I want. Thank you from the bottom of my heart. That was Dr. S, and she is now an active house call vet, which makes me so happy. And then we have another testimonial from Dr. K. This conference is so fab. The small group breakout sessions are perfect for introverts, learning practical and personal skills I can put into practice immediately. Worth every penny and so nice to soak in the wonderful collegial vibe of my people, my community. So if you're feeling excited, inspired, and ready to sign up, don't wait too long. Early bird registration is open only through January 1st, 2026. And the first 50 people that sign up for the conference get entered to win a mystical house call vet package that is curated by moi just for you. Head to the link in the show notes or www.dreveharrison.com to secure your spot and join a community of veterinarians who understand exactly what you're going through because we're living it too. I'm Dr. Eve Harrison, and I can't wait to show you just how amazing mobile practice can be with the right support and community behind you, and to celebrate with those of you who already know exactly how life-giving this path can be. Now back to our show.
Can you tell me a little bit about some of your favorite pain relief tools? Like you mentioned some sub-Q ketamine that you're doing and environmental
Mhm.
change and multimodal tools. Like I would love to hear what's your favorite pain management technique and what are you really into these days?
Oh, it's so hard to pick a favorite. I would say my favorite is probably acupuncture, but what I'm really into these days is the fascia and myofascial release. So, like, you're an acupuncturist, you know, acupuncture for pain is amazing. It is so helpful for things like back pain. Like, we're getting relief in like one session. It's wild to see the change in just the animal, how they move. But while I've been doing my examinations, I really, really target in and try to find the trigger points, the tension points, and then relieve them in a way that's fear free and stress free. So if I have access to a laser, which now I'm happy to say all of the time I will have access to a laser, woo! I really like to laser those points and then insert a single acupuncture point, and I can typically get release of the trigger point in that way, which I love compared to physios use, you know, that the dry needling technique with the really rapid needle movement in the muscle that if you've ever had, you know, you see stars, you want to pass out and you're not sure you want to go back to them. I do not do that with dogs. I don't think that's sane, safe, or kind, but I love just really getting that other form of myofascial release. It really helps. Laser is obviously amazing for like especially osteoarthritis, IVDD, but for some of the pharmaceuticals, I am really liking the sub-Q ketamine. For doses, I'm usually at zero point 0.5 mg per kg, and then frequency really, really varies. I have some dogs where we're monthly, and then other dogs where we're much more frequently, up to twice a week, quite frequent. And typically, when I'm at the point of sub-Q ketamine, we're sort of, we have our base of joint supplements, we have our ideally primary NSAID, or in some cases, like a Librela, Silencia. We're on the pregabalin or gabapentin. And then we've either done amantadine or the amantadine just didn't settle well with our stomach before we get to the
I love
ketamine.
amantadine. Nobody does amantadine, but it's one of my absolute favorite go-tos. I'm like, that is like part of my like first like
Yeah,
pain management. Like
I
so
love amantadine. It makes such a huge difference. It really does. And the thing is that I always kind of describe to I was doing it on the video this little hand pyramid. I always kind of describe to clients, we're building a pyramid and we are building it brick by brick. We want our big fat base of this pyramid to be non-pharmaceutical. Because if we are relying only, oh, there's my cat. If we are relying only on NSAIDs, we're relying only on medications, and we're still having them move in a way that's not supportive, have harnesses that are pinching them, we're not really going to get great effects. So typically, I like to really make sure they're on a good base of supplements. Omega 3s are my favorite. We also really look at the home environment. So, stairs, areas where they're going to slip, extra traction. toe treads if they can't have the extra traction. And then just really, it's funny what people in the clinic will say. And then you come to their home and you're like, oh, well, she does have to run down that big flight of stairs to get to your front door. She does that 12 times a day. That let's block that off because her elbows, like you just don't see it. And I get it because I bet you somebody would come to my home and be like, Lisa, what about this? And I would say, yeah, there should be a step there or a ramp there. I've thought about it for this long and I haven't done it. We all get a little bit blind in our home environment. I kind of loop harnesses into that because a poorly fitting harness can really cause a lot of back pain or restrict shoulder movement. But if we switch that up, that's sometimes something really minor and that can make a huge difference.
You have a favorite harness, or does it just depend on the
No,
you
my
both love
harness is from
harness?
Amazon, actually. It has cute little strawberries on it. I recommend something Y-shaped or H-shaped, and then just fitting it on your dog to make sure it's not sitting right on top of the point of their shoulders. A lot of the harnesses, and I mean, again, I just said I have a cute harness, but a lot of harnesses are designed to be cute or designed to minimize pull without really thinking, does it affect the dog's biomechanics? And they do, right? It's like if I gave you a pair of high heels and we're like, "Okay, please enjoy your 5K hike now." Like it could be limiting, right? So I usually just recommend an H or Y-shaped harness for that. And then for paws, I'm very big on senior podicures and paw care. So making sure the nails are an appropriate length as well as my cat's tail is joining us
Love
here.
it.
As well as I'm a big fan of toe treads or Dr. Busby's toe grips, because for a lot of folks, when I say, hey, how much laminate do you have? How much hardwood? They say all of it. So it's a little bit of a simpler solution, as well as protecting the toes if they're becoming neurologic and having any drag.
Love it. I see. Oh, there you are.
Is this
What a
Salem?
cutie. Oh my gosh, Salem. For those of you guys who are watching on video, on the YouTube, Salem is adorable. I'm screenshotting right now because how cute.
He's so cute. He's a good boy.
Yes.
He loves Zoom. It's one of his as one of my clients told me about her pet the other day, it's one of their great passions. It's like, "Oh." He likes being involved in the conversation. He's
Yeah.
very
Why
lucky.
not? Why
He's
not?
the one without any health issues, so
Good. Maybe it's the Zoom medicine. Socializing,
it's Reiki.
Great. I absolutely love it. Oh my gosh. So shifting a little bit in direction more towards strategy and things like this,
Mhm.
I'm curious what your experience has been like in the House Call Vet Academy. Is there anything that you feel you learned there or anything that you weren't expecting? And then I want to hear some advice that you might have for other folks who are interested in getting started in house call practice.
I hope I can share this and it isn't proprietary, but the most important thing I learned in the House Call Vet Academy was pricing
Mm,
and being diligent on your pricing, as well as to value your time as the most important service. That was really a big brain shift for me because how I had structured my pricing was listen, I'm here for a long time for this initial exam. It is a big deal. We do like ortho, neuro, we do all of this stuff. So it's going to be like quite expensive. And then I really want you to follow up with your acupuncture appointments and keep booking me so those are less expensive. But that really doesn't strategically work if you think about how many initial exams I'm doing in my structure versus how many follow ups. They're almost all follow ups with this type of care. So, changing my pricing structure to be a little bit flatter has been the biggest takeaway so far. That is brilliant. And it was just sort of a, oh, moment for me. Yeah.
amazing. Yeah. Oh, I love that. Yeah, that's one of my favorite things too about the academy, like the focus on pricing and how people can think about it. Like there's a lot of mindset shifting that is
Mhm.
involved. It's not just this is what your price should be. I mean, obviously, we're all in different demographics and we all have different types of practices. And so the specifics are going to look different from everyone. But I think that that mindset shift is what can
Mhm.
really unlock answers for a lot of different people. So I love that that's what your big takeaway. Like, I love that. That makes me
Yeah.
very happy.
No, it was a good one.
Very fun.
Also, I think how you promote the structure is incredibly important for people getting into this. There are a lot of people who get into businesses and they take out a 500K loan, a bigger loan, huge, huge loans. Whereas this is actually an area that can be extremely low overhead, low risk. It allows you to figure out your space. And I think promoting that mentality is really important because, quite frankly, I could have a spare room full of every single medication known to man, but it's probably going to sit and I'm probably going to lose money on it. And that's one of our big fears starting out in business, right? So I think sort of promoting that mentality of being light, lean, not investing too much in sort of your initial setup, if feasible, is wonderful advice. Like really, really, really solid.
So glad that was helpful for you. And now I'm curious, what's your advice for people who may be interested in getting started with house call practice, or maybe who have a house call practice and they're not feeling that like
Yeah.
joyous feeling that you've described, or they're struggling? What
Yeah.
might you?
I would say my biggest advice for anyone getting into this realm is don't let great be the enemy of good. Just do it. Because I speak to a lot of people they want to do this, they're interested, but everything has to be this perfect, beautiful bundle. And that is not real life. And the reality of life is you could construct the most perfect, beautiful bundle, something is going to shift. And it might be how you feel. It might be what you discover when you're starting working. It might be the economy. Like,
Yeah.
that's not life. Life is dirty. Your good is great. Just do it and figure it out. It's attainable. Um, be smart about it, obviously, but it's really accessible and you just have to do it without getting too intense about your own fears and feelings.
Fuck yeah. That is
Yeah,
such good advice.
yeah,
Yeah.
yeah,
I love it.
yeah.
Don't let great be the enemy of good. That's exactly
100%.
right.
Yeah.
Yeah. I mean, there's so many levels of that we can apply to ourselves as veterinarians, as business owners, as probably generally perfectionist human beings with those tendencies, most of us, I believe, right? Recovering, I think most of
Yeah.
us are recovering who are in the house call space. Like when you become an entrepreneur, you learn. If you didn't already learn from being a vet, like things never go as planned. Like things are never perfect. But it's another layer of learning, I think, when you're an entrepreneur that not everything is 100% within our control, and we can ride those waves, and we can celebrate ourselves when it's good, when it's
Mhm.
solid. We've done our absolute best, and it's never gonna look exactly like how we thought in the beginning. So, so brilliant. I'm so glad that you mentioned that. That's, very, very important principle, I think.
I think that's life too. And I kind of think it's one of those things that we can even apply to cases because sometimes it's very easy to say, this is the gold standard, or this is all of the wonderful things that this patient should receive. But when you start to look at the other factors in play, like the physical limits of the caregiver, the financial limits, all of these things, it's like, okay, well, maybe that is a great plan, but maybe it's not a great plan for this situation. Like, how do we really tailor it down? And that's another beautiful thing about the house call experience is it gives you the time to do that. And you physically see it, right? If I am asking somebody to do something that is time expensive in the sense that they're really having to spend tons of time doing it, and I go to their house and there's like a toddler here and another cat here I get a little bit more that I'm like, okay, maybe you're not going to do those senior exercises and we should work harder today on on this. Like that's life. It sort of applies to everything.
Oh, I'm loving this conversation so much. This is reminding me, what of something that happened when I was working relief, and I had a client that came in that I knew from through someone else, and I was so excited to, like, really give them a lot of value. They had an animal that was, like, struggling, old, and they had nothing. They really knew minimal stuff, and I was like, "Oh my god, there's so much that we can do. I'm so excited to be the person that provides you with this incredible amount of information." And I'm also very into pain management, so I listed,
Mhm.
like, this thing and this thing, we could do this, we could do this, we could do this, we could do this, we could do this. I, like, went on, and I was, like, so excited in my head, and, like, I saw her face drop, and at the end, she was like, I can't remember if she complained to me or she complained about me, that I was just trying to sell her all this stuff, and I was like, "Oh my god, that was so the exact opposite of what was in my heart," and
Mhm.
I I learned a lot that day that you're not gonna throw every single thing. And I mean, that's a tendency I have. Who knows? Maybe there's some neurodivergence there that's sort of like, I mean, a lot of us have in
Yeah.
veterinary medicine and in the house call space, I think, do a little bit better in our own paradigms. There's some neurodivergence, I think, for some of us, whether it's a diagnosis or whether it's just tendencies or whatever. But I have a tendency to, when I'm excited, I'm like, blah, blah, blah. And if it's like, healing things and pain management, I went off on her. I didn't realize, I had no idea that I was like, this is I was aiming for some version of perfection. I was like, "And don't forget that. Oh, that's another thing that you can tell her that could really help." Just like
Yep.
on and on and on, and she was very upset that ultimately. So at
Mhm.
times, like, even in striving for perfection, not only does it, like, inhibit us, it can actually, like, damage the whole system on some
Yeah.
capacity.
Yeah.
You know what I mean?
Yeah, because it's about figuring out what's realistic. And I have to say, I have also been guilty of the 10-point email before, where it's like, okay, so step one, step two, here are all of our options. Where,
Yeah.
again, I'm so excited. I want you to know all of these wonderful things we can do. And this poor person is deeply overwhelmed. But when you have that time, it's so nice to really just chat about people and say, like, sometimes I say, hey, listen, I'm going to tell you what I'd like to do. And then you're going to tell me what's realistic and what's practical. And we're going to start somewhere and we can add things on as we go. Sometimes we just start with like walks. He's never been on walks before. Like, okay, well, maybe to get his joints moving, could we see if he'd do that for us? Like sometimes it's really, really simple, like walks and omega 3s. And then other times people are like, "Yep, I'm an RVT, I work in anesthesia, let's go." And it's just about meeting people where they are. And it is hard because you really have to take yourself out of your space
Oh, yeah.
and then put yourself in their space.
Beautiful, beautiful.
Mhm.
And I mean, another phrase that I think sometimes is applicable on many levels of veterinary medicine, less is more, right? Like, not just with this scared animal, less restraint can be.
Mhm.
I practice that very diligently in the home. Less is a lot more. I do
Mhm.
let the animal be held and comforted by the client as much as possible. But less is more sometimes in terms of treatment plan. Like, not only is it, potentially a neurodivergent quality to be very, very excited and like pebble or give all that information all at once, like brain dump out of love and concern and desire to share. But there's another motivation for that kind of thing in the veterinary field, which is perfectionism, which is a type A. I have to get it perfect. I have to give, looping back to the perfection
Mm.
twist that we can experience. And that if I'm not giving this, I'm not giving the gold standard. I am not good enough. I am imposter syndrome, imposter syndrome, imposter syndrome. And I'm proving to myself and to the client that I know a lot of things. So that's another way that this can show up for veterinarians. And more and more over the years, as the years have gone by, less is more, less is more, less is more. Give them less in the initial consult, do less in the initial consult. Let the vibes settle. Give them a couple little magical things that they can do. They feel that they're making progress and they're not overwhelmed. So I love that you mentioned the 10-point email. Oh, oh, so many. I have elements of that I've trimmed down over the years, but so many people want to give discharge information after every house call, and it's this long, and no one's reading it. No one cares. No one cares. So it's like we can do less, so much less. So I love what you said about that.
100%. And It's really interesting because I feel like we were trained, at least I was trained at veterinary school in so much the opposite way of here is the gold standard, here is what is right for this type of case, really, really focusing on like an abstract concept as opposed to really, really meeting people where they are. And then I think it leads to some type of guilt where, you know, oh no, we're not getting back surgery. I'm like a bad, it's not a well managed case or this and that. Well, not everybody has like $15,020. Maybe it's a very real limitation, a very real parameter. And that exists in so many different ways. And I think we carry a lot of guilt and a lot of ego about trying to push that forward, where the real life solution is just you do what you can do. And what you can do depends very much on that client and it depends very much on that pet. And everything is going to go better when you meet people where they are.
100%. I feel like we could have this conversation continue for another 8 hours. Like, I have very strong observations, opinions, or passions about the
Mhm,
subject of ego and doctoring, and
mhm,
how occasionally you have someone who's just straight up arrogant, but more often than not, like, the ego coming through so strongly is the desire to overcompensate for insecurity, right? And so many of us are insecure, and it comes out as ego. I mean, that's what it is. It's the ego fighting for its life to be like, "I am good enough, damn it." And
mhm.
so it's this overcompensation that comes out as arrogance when it's like the polar opposite. It's so interesting because I think that the way to address that systemically is to give people more confidence as veterinarians and to know that more confidence, right? Not less. Not to tell people like you're an egotistical dick. In the human medical field, there's some degree of that. It just somehow it I don't know. I mean, there's both. There's both elements of it. But sometimes ego that's sort of stuck in rigid paradigms that's like, I'm not good. I'm a bad vet if I don't follow or doctor if I don't follow this code of principles. But what's also interesting is I recently worked on another veterinarian's dog doing acupuncture. And this veterinarian is sweet, kind, like wonderful human, a lot of imposter syndrome. We had worked together a while back and she remembered me. She was like, I remembered how sweet you were with the animals and I want you to work on my dog. And I was like, this is the most like flattering thing that I've ever
Mhm.
heard in my life. And the whole time she was like, well, I did this, but like really feeling guilty about not doing things. And like in the presence of another veterinarian, she didn't do what she was supposed to do. And she was bracing herself for judgment from me. And I'm like, listen, you did a beautiful job. I'm not that person who's gonna be like, "Well, why," you know? But I could feel her fear of just being seen by another vet as not having done the right thing or the rigid gold standard thing, and I'm like, "You did perfect. Like,
Mhm.
you know this animal better than anybody else. You're a vet, and you're more qualified to know what this animal needs more than anyone else. So if someone has said some shit to you, fuck them because
Yeah.
you are the authority here and I am going to support you in any decision that you have or will make. But it was just so uncanny. It's been so long since I worked on another veterinarian's animal and to see what even another colleague is bringing to me as their fears, you know?
Mhm.
So it was just really an eye opener of where we are as a profession.
That's really true, and it's really sad because Salem's knocked something over now. Thank you for your assistance, buddy. But I do think that as a profession, we're in this really tenuous place. We've been raised by vet schools to honestly come out with very little confidence, I feel, unfortunately, as well as some trauma in terms of, not only burnout, but anxiety. And then we're facing pressures from corporations and pressures from ourselves. And I honestly feel like a lot of people, you know, aren't happy. And what was the point of working so hard to go to vet school if we're not going to be happy doing what we love, which is helping animals? Like it's not that complicated. We are just trying to help people and help their pets. And I sort of feel like to bring it back to circle, like one of the solutions is that people are going to find niches that they really love. They're going to go out on their own and they are going to offer vet care that they feel really, really stellar about and wonderful care for pets too. I hope that's going to be healing for the industry and maybe a positive shift overall. But I think we're in a tough place and we honestly need more of this to heal everybody.
I love that. Thank you for bringing it full circle. I think this is a beautiful place to close up the episode. I agree with everything you said. This has been a very moving conversation for me. I'm feeling very connected, and I hope our audience members are feeling the love and some inspiration and understanding and validation as well. I think we all need validation with what we've been through, including the trauma that you mentioned, right? So before we close up, can you share with me what your favorite beverage is? What might you like to order inside the House Call Vet Cafe? I'm drinking my from my new water bottle that I love. I got it from the
Oh,
LA
I
Zoo.
love it.
Isn't it cute? Save the chubby unicorns. What does it say in the bottom? Oh, San Diego Zoo Wildlife Alliance. Yeah, I forgot which zoo it was. What do
That is
you like?
so cute.
What would you like to order today?
I love that. I'm a coffee girl through and through. I am having a coffee at most points in the day. Any type of coffee. It's not usually fancy. It's just coffee, really rich, really dark. I like bleed coffee. I'm very passionate about it.
I love that. So you're like essentially on a coffee CRI all day.
Pretty much, yeah.
And how do you
That's
sleep?
how I function.
Can you sleep? Like, do you have trouble falling asleep, or you're just
No,
so
no problems at all.
oh, I'm so jealous. Oh my god, that's amazing. Well, thank you so much for being with us, Dr. Lisa. This has been a fantastic conversation, and I can't wait to talk to you again next time.
Thank you so much for having me. It's been wonderful.
Thank you so much for listening to this episode of the House Call Vet Cafe. If you enjoyed this episode, then hit the subscribe or follow button on Apple Podcasts, Spotify, Google Podcasts, YouTube, or wherever you listen to podcasts so you never have to miss an episode. This podcast is made specifically for you, so don't be shy if you'd like to reach out and let me know your thoughts on this episode. You can find me on Instagram and Facebook as the House Call Vet Academy, where I also share more valuable content. If you're interested in learning more about consulting for House Call Vets or the House Call Vet Academy online course and community, please click on the link in the show notes. Have an amazing rest of your day, and I can't wait for you to join us for our next episode of the House Call Vet Cafe.